And I am now informed that the TV sound system is also working. Question number 5, Honourable Annette King.
Thank you, Mr. Speaker.
Order, order. Let your member have a fair go. Honourable Annette King.
Thank you, Mr. Speaker. My question is to the Minister of Health. Does he stand by his statement that the government will not agree to anything that, quote, doesn't improve patient services?
Honourable Tony Ryall.
Mr. Speaker, yes, within the context of that statement made 4 years ago, referring to the high-level recommendations of the Ministerial Review Group. I also stand by my statement that despite millions of dollars of extra funding, some programs may be slowed, changed or stopped. An example of this is Fruit in Schools, where we've stopped millions of dollars being spent on administration and we are now providing more fruit to school kids for less cost.
Supplementary question, Honourable Annette King.
If quality is important to him, did he agree to the proposal from Health Benefits Limited, which he set up in 2010, to close all public hospital kitchens and have TV-styled reheated dinners fed to sick patients, prepared only in Auckland and Christchurch, and then transported hundreds of kilometres around New Zealand?
Honourable Tony Ryall.
Mr. Speaker, yes, I am aware of that from a media report today. What I can say to the member is that the Health Benefits Limited are working on a business case to try and save money, and any money that's saved in changes to kitchen services will be reinvested back into the New Zealand Public Health Service.
Supplementary question, Honourable Annette King.
Is he aware that the preferred provider of these budget airline-style meals for sick New Zealanders in our public hospitals is the Compass Group, a UK multinational company which recently fed horse meat in their dinners? If so, how does he intend to measure the quality of the food provided by them in New Zealand?
Order! 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 I'm interested in the answer.
Oh, yes.
Honourable Tony Ryall.
Goodness me.
Order. Honourable Tony Ryall.
Mr. Speaker, I've yet to receive a formal proposition from Health Benefits Limited for this. I can tell the member, as she knows, a large number of hospital kitchens, even when she was Minister of Health, were contracted out to the private sector. They've got a long history of involvement in hospital kitchens, and I can assure the member that before any district health board, before health benefits were to proceed with this, they'd want to assure themselves as to the quality of the hospital food and the standard of food that's being provided to New Zealand patients. What I can assure the member is that every dollar saved through more effective back office services will be reinvested in frontline services for New Zealand patients, like more operations and more care for New Zealanders.
Supplementary question, Darien.
Thank you. To the Minister, has he considered the impact this will have on the 1,300 or so low-income workers and their families who work in hospital food services throughout New Zealand?
Honourable Tony Ryall.
Mr. Speaker, look, I'm absolutely certain that the interests of those people are being considered in these decisions. Many of whom, those 1,300 people, are employed by private contractors now. And many of our hospital kitchen staff. And so this is what they're looking at. I have to say, in tight financial times, I welcome smart ideas that can save on back office administrative costs so that we can put them into frontline services, but members can be assured quality and, I hope, improvement of hospital food in some parts of the country are a major consideration in this.
Supplementary question.
The Minister, will he be prepared to front up to hospital food staff in his electorate in every town and country throughout New Zealand to tell them that they're back office staff and deserve to be laid off en masse?
Honourable Tony Ryall.
Mr. Speaker, I think the member's getting way ahead of herself. Health Benefits Limited is preparing a business case to take the district health boards to see what we can do. The key thing here is I would have thought the opposition would want the money that we have in health spent the most efficient way possible. That's why so many services were contracted out when Annette King was Minister of Health. We want the money being spent in the most effective way, maintaining quality, with any savings going back into more services for patients.
Question number 6, Honourable Kate Wilkinson.
My question is to the Minister of Justice and asks, what actions is the government undertaking